Today we are having our 8th annual Women's Health Day. We're celebrating Women's Health Day in conjunction with the National Women's Health Day. National Women's Health Week kicks off on Mother's Day. So this is a continuation of recognizing and celebrating women and mothers and lifting up the issues about women and how we can take better care of ourselves, better care of our families, and become better communities.
It is so nice to see everybody here, and I have to say the same. From this point of view, everybody looks beautiful. I would like to bring greetings from the Board of Directors, Louisiana Center for Health Equity. We have been celebrating women in this type of forum. This is our 8th year. And every year we improve and we get better. So today I would like you all to just take the time to look at or to at least take in take in everything that the speakers will impart to you, bring it back to your community. We have women from across the state, and this is all of the information to share with your local policymakers and people in your communities. Women's health, the movement soars. Last year, the movement began. We've had so much that have happened positively for women at the national level and here at our state level and around the country. So we looked at our theme, not just for Louisiana, but what we see nationwide. Also this year, we would like to thank our collaborators, the Louisiana Legislative Women's Caucus and the Governor's Office on Women's Policy for collaborating with us to put this program on, as well as our many partners of women's organizations across the state. So again, this day is an opportunity to celebrate women, to look at our health, to see how we can better impact policies at our local level and policies at the state level, and take the opportunity to talk with all of the women of our women legislators, and also to thank them for a job well done. Thank you and welcome and greetings to all.
Good morning, everyone. Good morning. I am honored to be here. It is such a pleasure to see so many beautiful women all in one place. No pun to the men here. Hi, gentlemen. But these ladies, you look absolutely awesome this morning. And before I read the proclamation from the governor, whom I love and greatly appreciate, I want to take this opportunity to just ask the young ladies from Scotlandville Magnet High to please stand. We just did a lift snapshot tour of the Senate. If you ladies would just stand. And then I want to recognize Miss Veronica Freeman and Miss Adams for their commitment to work with these young ladies. You know, this is what it's really all about. It's about the next generation. It's about making sure that they're ready and prepared. You ladies can have a seat. Y'all look wonderful. Thank y'all for coming and being with us here at the Capitol. And next, I would like to see if there are any of my other colleagues that are here, any other elected officials. I see School Board Member Don Collins. If you would just stand, please, and we acknowledge her. Thank you for being here. And on behalf of my colleagues that I work with and serve with, you guys know we are going in 100 million different directions at the same time. So many of them are actually probably in committee at this time. And so I'm just going to give their regrets for not being able to be here. But I want you to know that we stand happily behind you and appreciate your work, Ms. Stewart, and your entire team for what you do every year to make sure that this issue stays right at the top of the list. So on behalf of the governor, I have a proclamation, but before I read that proclamation, I do want to say that I am the chair of Select Women and Children, and I have really enjoyed serving as the chair. In the next week or two, we will have a hearing to talk about the state of children in Louisiana, connecting the dots in terms of how policy affects children, how policy affects families. And so I think once we start getting that data and putting that information together and looking at the state of our children in this state, it may help us to make better policy decisions. But anyway, again, the governor has given us a wonderful proclamation here declaring National Women's Health Week to be celebrated May 12th through the 18th. Serves as a reminder for women to make their health and wellness a priority. Whereas a March 2018 study by the Women Institute for Women's Policy Research ranked Louisiana 48th in the nation for employment and earnings among female workers and 50th for poverty and opportunity. Now, I'm going to tell you, I hate to pause here, but this is just an absolute travesty. And everybody in this room and outside this room should be completely upset. We cannot continue to travel down this road. And as I just acknowledge these young students from Scotlandville, this is our next generation. And this is not the baton that we want to pass on to them. So we have to begin to change the policy. Whereas women have the right to equal pay for equal work, but women working in Louisiana have faced one of the largest pay gaps in the United States, and Louisiana ranks last for pay equity. Whereas Louisiana Center for Health Equity gives voice to the needs of women of all backgrounds and provide them with the opportunity to learn more about improving their physical and mental health through information that will inspire them to take necessary steps to maintaining and improving their health. Whereas Louisiana expanded Medicaid program has provided consequential improvement in access to care, better health, and quality of life for hundreds of thousands of our citizens, and have done much more to protect these gains and continue this progress in the future. And whereas human trafficking in Louisiana continues to increase, and it's important to engage and inform girls and young women of this issue, and a call to action of awareness and education campaign, building the progress the state is pursuing in its new child trafficking collaborative, which you will hear a little bit more about later. Now, therefore, I, John Bell Edwards, Governor of the state of Louisiana, do hereby proclaim May 16th as Women's Health Day in the state of Louisiana with the affixed signature of our great governor. And Ms. Stewart, I'd like to present this to you. And let's give her another hand of applause. When we signed the Affordable Care Act into place, she was right here, standing almost in the same exact position with the governor as he signed that into law. So again, we want to thank you for your work. We want to thank you for your commitment, and thank you for continuing to be a voice for sometimes the voiceless women who do not have the opportunity to come up to this Capitol and state their position. Thank you, and God bless you.
Thank you so much.
Good morning.
Good morning.
I'll ask, I have a little bit of a PowerPoint, so if we can work to get that up. So I'm so glad that you were able to be here today, and so thankful to Alma and the Center for Health Equity and the Planning Committee and all the people that it takes to make something like this happen, especially to know that you've been doing this for 8 years. That's incredible, and what a great opportunity that we know we can count on to get everybody together to learn more about women's health and to engage with our wonderful policymakers downstairs. So thank you for that. My name is Amanda Brunson. I'm the Director of Women's Policy here in the governor's office, and our job is really to understand what the issues are that are impacting women around the state and help communicate about those issues to our policymakers. And so at the Office on Women's Policy, we know that we really cannot talk about thriving women or thriving families without looking at the environments in which they live. So how many of you have heard of social determinants of health? A good many. So I feel very blessed that I've spent a lot of time in the last couple of years with a lot of public health professionals, and let me tell you, you can learn a lot of stuff from them. And so I want to share my little bit of knowledge with you here because we really cannot talk about women in a vacuum. We've got to really talk about all of those areas of life that impact health. And according to the federal government's Healthy People 2020 project, social determinants of health are conditions in the environments in which people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risk. So in essence, these are things that you don't necessarily control, but that have an opportunity to impact your risk or protection against certain health consequences. So these are the social determinants of health that Healthy People 2020, which is a federal framework for health impact, has used, and they're the ones that we are looking at within the Office on Women's Policy. So economic stability, education, social and community context, health and healthcare, and neighborhood and built environment. And so by no means are these all the social determinants of health, but these are the ones that we're choosing to focus on. And I'll ask you to advance the slide and show you a little bit more about what's entailed in the Healthy People 2020 framework, which the government is working on Healthy People 2030 now. And so we'll see if these change a little bit. But these are just another quick shot at kind of what we're talking about within economic stability, education, and so on. So the purpose of my talk today will be to dive deeper into the economic stability piece, but before I do that, I want to show you one other public health model that I've gotten a lot out of, and I hope that you will as well. So this is the health impact pyramid. How many people have seen this before? Good. So basically, it's a framework that helps us look at how we can impact health in a comprehensive way. And at the top of the pyramid in the small triangle is health education. So that's professionals telling an individual what they need to do to improve their health. But at the bottom of the pyramid are things that are really at the community and society level that can impact the health of a lot of people. So as we go from the bottom to the top, it requires a whole lot more individual effort to be able to have broad population level impact than those levels that are right there at the bottom. So at the very bottom, we have socioeconomic factors. So these are things like education and employment and income level. And at the next level, we have changing the context to make individuals' default decisions healthier. So those are things that we can do still at the community and society level, but that have a huge impact on people. So if you think about things like adding fluoride to our water. We have had fluoride in our water systems for, I think, about 70 years, and we've decreased the number of cavities that people in the U.S. have had by about 25%. So that's huge, and it's something that we were able to do where individual people are not having to make those healthy decisions, but it's had a real impact on the overall health of people, the amount of money that families have to spend for their dental health, and then the amount of money that our government, our insurance providers, and so many people do. At the next level is long-lasting protective interventions. So these are things like maybe vaccinations or going to get colonoscopies every 5 years. So things that you can do that are preventative, but that have a longer impact period. So you don't necessarily have to do it constantly to be able to improve your health. And then the top part of the pyramid So we have clinical interventions. So those are things like going to your doctor and staying on top of the management plan for diabetes or high blood pressure or cholesterol, or some of those things that you know you have to take some individual action and have regular ongoing efforts on your part to take care of your health. And then at the very top is the counseling and education piece. So how many of you have had a doctor tell you that there was something you needed to do for your health? Probably all of us. What are the top 2 things that the doctor is likely to tell you to do for your health? Exercise and diet. Smoking is a good one too. How many of you diet and exercise? Probably very few of us. So the point there is that it takes a lot of individuals making a lot of individual action and efforts for their health, long-term behavior change, before we would really start to see population level impact with just talking about education and counseling. So the reason that I tell you all these things, if we can go, I think the next slide is back to the first. Social determinants of health. For the Office on Women's Policy, we've decided that really what we need to focus on are the things that are going to have the biggest impact for the largest swath of the population, which is going to be those socioeconomic factors, all the things that are at the bottom level of that pyramid. So what I'm going to talk to you today about are the economic stability piece, which is at the top. Really, it has the most opportunity to influence so many things with our women, our children, our families. So have you seen the United Way Alice report? Yes, powerful stuff. So I want to talk a little bit about where we currently stand in Louisiana. So the Alice report is put out every couple of years, and it really takes a look at our families and what it takes to survive as far as family income, what it takes to meet your basic needs as a family. So in the Alice report that just came out in the fall, maybe, we know that 19% of our families in Louisiana live below the federal poverty line. Another 29% are ALICE, so that's asset limited, income constrained, employed. These are our working poor. These are families who are trying their hardest and yet they're still barely able or unable to meet a basic household survival budget. So those would be things like housing, transportation, childcare, a cell phone, health services. And so if we put those two categories together, our families that live below the poverty line and then our ALICE families, we're talking about 48% of Louisiana households that cannot make ends meet at the most basic level. Nationally, in 2015, 42% of mothers were the sole or primary breadwinners for their families. And in Louisiana, 48.7% of households led by a single mother with children live in poverty. The number of single women-headed households decreased by 3% between the last two ALICE reports, so 2010 to 2016 data, but the percentage of those families who are in that ALICE or below the federal poverty line increased by 7%. So we know that we have a lot of work to do in this economic stability area. So the Women's Policy and Research Commission is a statewide commission made up of women from around the state, different areas of interest and expertise, mostly in all these social determinants of health. And every year they put together an annual report to the governor and to the legislature. That report is hot off the press. It was approved yesterday. So I do not have a copy of it all together. I'll tell you this is what it looks like, and I will send it to Alma so that we can hopefully get it out to everybody. But I gave you just the summary sheet. It's on the back table if you did not get a copy of it. That really gives you a look at how women in Louisiana were faring in 2018. So also in this Women's Policy and Research Commission report, they identified the priorities that we should be focused on right now to improve the status of women in Louisiana. So the ones that I'm going to talk about today are the ones that are related to economic stability, and they are efforts to ensure women are paid the same as men for equal work, raising the minimum wage, increasing access to paid family leave, access to quality early childhood care and education, and increasing the number of women in STEM fields. So we're going to talk about each of those things briefly. So we'll start with equal pay. Louisiana is last in the U.S. for what women earn on average compared to men, 69 cents to the dollar. Black and Latina women are worse off. They make an average of 48 cents and 52 cents respectively compared to white men. The gap exists in all fields, regardless of profession or educational background, and jobs predominantly filled by women are generally paid less than jobs that are predominantly filled by men. So there are several root causes for pay disparity and several things that can contribute to narrowing or eliminating that pay gap. And one of those measures is eliminating pay secrecy. So the governor is supporting pay transparency legislation that's authored by Senator J.P. Morrell. It's Senate Bill 136. The legislation will advance equal pay work by prohibiting employers from taking actions against employees for inquiring about, discussing, or disclosing their wages. And we know that in the 11 states that have pay transparency laws in place, the pay gap is smaller, and in general, women are earning more in those states than in states where they do not have pay transparency laws. The second area is minimum wage. So Louisiana has among the highest percentage of workers earning at or below the minimum wage in the U.S. And nationwide, 2/3 of minimum wage workers are women. Mostly, they do not fit in the stereotype that most people are thinking about when they think of minimum wage workers. They think of high school kids, college kids, people who are single. And in fact, half are over the age of 25. Many are married and have some level of higher education, and most are working full-time to provide for their children and families. Only 5 states have not enacted a state minimum wage, and Louisiana is one of those. We are defaulting to the federal minimum wage, which is $7.25, and that hasn't been raised since 2009. So the governor is supporting a constitutional amendment by Senator Troy Carter to provide for a state minimum wage of $9 per hour in Louisiana, and this is Senate Bill 155, and that puts the decision back in the hands of the people. On paid family leave, a statewide survey found that only 35% of moms in Louisiana were able to take any length of paid leave following childbirth, compared to a national average of 55%. Lack of paid leave contributes to the 11 percentage point gap between men and women's participation in the workforce. And there's a lot of conversation around this happening not only at the state level, but also at the federal level. And most people are agreeing that paid leave is a smart investment, but there is a lot of disagreement in how we pay for that and what those systems look like. But most of those paid leave policies include leave not only for the birth or adoption of a child, for the worker's own serious illness or injury, but also for the serious illness or injury of a family member. A lot of them also include leave time for victims and survivors of domestic violence. And many of them also include leave time for caring for aging parents, because for many of us, we will spend more of our time caring for aging parents than we will caring for young children. So Senator Morrell also has a bill to establish a paid leave system for Louisiana. That's Senate Bill 186. On early care and education, access to quality child care is essential for women to participate in the workforce, but also for women to stay involved in the workforce and not have to step out for a couple of years to care for their children. For women with young children in Louisiana, 15% reported having to quit a job due to child care issues, in contrast to 2% of men. 16% of women reported going from full-time to part-time, compared to 3% of men. And 12% reported turning down a promotion due to child care issues, compared to 2% of men. So commercial child care facilities charge anywhere from $110 to $200 a week, and that can cost up to 50% of a minimum wage worker's income. Last year, Representative Stephanie Hilferty authored a bill to create an early childhood care and education commission. That commission has been meeting, and their most recent report said that we need to be investing $86 million this year and every year for the next 10 years to be able to get our early childhood systems up to where they need to be to really support our children and families. And then the last economic stability area that I want to talk to you about is women in STEM. So the Women's Commission identified this as a priority area because STEM traditionally, STEM fields earn higher wages than fields that are not STEM related. And so there's also a clustering of women in lower paid STEM jobs, like for example, healthcare, and underrepresentation in things like engineering and computer science. And you'll see in that infographic that you have that computer occupations have grown 338% nationally since 1990, so that's huge. But at the same time, we have a decreasing percentage of women who are participating in computer occupations. So there was a task force that was created. The bill was authored by Senator Sharon Hewitt a couple of years ago that created LaSTEM, Louisiana Science, Technology, Engineering, and Mathematics Advisory Council. It's under the Board of Regents, and one of their focus areas is also increasing the number of women in STEM field. So these are just a few things that you can focus on in efforts to increase the economic stability of women and families, and we know that those have a direct impact not only on the bottom line financially of what families have to work with, but increasing economic stability also impacts things like health. It can prevent child abuse and neglect. It lessens your risk for domestic violence and sexual violence. So it just goes on, which is why it's one of the core areas that we really have to focus on if we want to make sure that women are not only healthy but are thriving. So I want to leave you with one final note, and that is that Louisiana's population is 51% women, but only 15% of our elected officials are women. So we're so thankful to Senator Barrow and all of the few but brave women who serve down there. And so even if you do not want to run for office, it is really important that they hear your voice. And so thanks again to Alma Stewart and the Center for Health Equity and everybody that helped to get you here today. So please make your voice heard and connect with your legislators. Thank you.
Thank you so much for that great information. Let's give her another hand. Our next speakers will talk about human trafficking, which is a grave concern for us here in Louisiana. Dr. Dana Hunter is the Executive Director of the Children's Cabinet Office of the Governor, and Elise Cole is the Director of Anti-Trafficking Initiative and Power 225. Please welcome them.
Good afternoon, everyone. Good afternoon. Thank you so much, Alma, for inviting us to be here today. I just have some very brief but important information to share with you on a subject we hear a lot more about today, human sex and labor trafficking. In 2018, DCFS released a report which revealed that there were 681 confirmed or prospective cases of human trafficking in our state of Louisiana. Globally, there are millions of people who've experienced human trafficking. But when we think about Louisiana, 681 confirmed or prospective cases. Gender, the gender of those cases is key. 533 of the 681 were female. 78.3%. We see it, we hear about it. If you're on social media, you see the ads that say women are missing. This person, female missing, lady missing, 18 years old, 20 years old. This is a serious issue that's happening right here in our state. It's happening across the country, but to know that it's happening right here in our state, this is serious. I first learned about human trafficking years ago, working at the Department of Children and Family Services. I was a new caseworker. I had only been there a year. And I'd got called into my boss's office to get a new case. This case was a 13-year-old who presented to the department, who had just a mother, imagine a mother, who wanted her daughter to first meet her biological father. This mother introduced her daughter to her biological father at the age of 13. When this father met this young girl, hi, oh, this is my daughter? Nice. The very next day, the very week that the father met his daughter for the first time, he didn't look at her like, this is my biological daughter, what can I do to support her, to support this mother, to care for her, to be there for her in her teenage years. He looked at her like, how can I take advantage of her? This biological father, who at the age of 52 years old made his 13-year-old daughter his girlfriend, his lover. She then became a victim of human trafficking. We didn't know that word back then. I didn't know that word back then. The 13-year-old who was running from home, abandoned home to abandoned home with her father, didn't know she was a victim of human trafficking. But what she did know was that my father, who's 52, and I'm just a tender child at 13, he's not letting me go to school. He's taking me into drug-infested houses. He's making me perform all sorts of sexual acts on him daily. The biggest piece of information to this case was that the father, 52, who made his 13-year-old daughter his girlfriend, who sold her all across the city of Baton Rouge for money, had full-blown AIDS. Full-blown. I could not wrap my mind around something like that happening right here under our nose. But it was happening. And let me tell you, our data confirms that 681 confirmed or prospective victims last year were experiencing similar things. 176 of those victims that were confirmed last year were ages 18 and older. 176 women ages 18 and older. 312 of the victims last year were ages 17 and younger. I say that again to our beautiful young girls here. 312 of the victims of human sex trafficking were ages 17 and younger. That could be any of the young people here in this room today. We are hearing it. Our young girls, and Alice will come up later and tell you more of what to expect, what you can look for. But our young girls are being taken. I had a conversation with a district attorney who said there's a local high school where girls are being branded. We are finding brands, tattoos and brands on these young girls right here. He said, and we're seeing it more and more. And the saddest part about this is that these young girls are being trafficked by their own moms. But, and he said, we're connecting as we do our investigations. We're seeing the same brand on the daughter, on the mom. And so what we know is when we hear from Amanda Brunson and we hear about low income and women not earning wages, I sat down 2 months ago with a woman in New Orleans who was a sex worker. She danced in a strip club in New Orleans, and she was proud of it. And she said, I don't want anybody coming to tell me that they're closing down our club and that we shouldn't do this. So I sat with an open heart to hear from her. And she said, what people need to know is, this is how I take care of my daughter. This is how I take care of my children. And when they take this from me, they take food out of my child's mouth. So instead of judging her, I could hear the desperation of a mother who says, maybe if I had gainful employment, maybe if I had education opportunities, I wouldn't have to choose this lifestyle. And so it's incumbent upon us to really know and understand the repercussions. And I'm grateful for our governor who fights for equal pay and minimum wage. I'm grateful for the leaders in this room. I'm grateful for our senator. I'm grateful for others who say we have to make sure women have opportunities to care for their young children, because when they don't, it opens opportunities for them to say, well, maybe I should try this. It increases their risk to be a victim of human trafficking. Why would I say that? Because when a man approaches a woman, or when another woman approaches another woman and say, hey, I can take care of all of your needs, that woman says, well, you know what? I don't have enough money for rent, bills. Maybe I should consider this. And there are women today and young girls today who are considering becoming a victim, or who could potentially become a victim of human trafficking. Why? Because they don't have housing, because they are living from pillar to post, because they don't have money for food, their basic needs are not being met. The young girl who I described to you did not have adequate housing. She started at 13. She's 27 years old today. She's had 3 children. She's lived in numerous homes trying to make it and provide for her kids. She's been with older men. She continues to be with older men. Why? Because she says, I need help. And so we have to make sure that resources are there. When I hear from this young girl and she tells me, Dana, I got a job, I say, I'm proud of you. Because I know the struggle. I know what you've been through. But then there's this problem. I don't have anybody to watch my young child. So then there's no child care assistance because the waiting list is 5,000. Yeah. So then she says, so I'm letting this person, the 52-year-old boyfriend, watch my baby. So we're hoping and praying that this person doesn't molest or take advantage or beat or physically abuse the young child, because that's the only option. And so I encourage all of us today, to know that human sex and labor trafficking is a very real issue that's happening right here in our state, right here in our city, right here under our nose in our own backyards. Let us be aware. We, as our Children's Cabinet and our Governor's Office received a $1.2 million grant to help address this issue. We are working with partners all across the state. Our governor and our first lady are champions for this issue and have made addressing this a priority. They are traveling the state as well to say, what can we do? Who do we need at the table? Bringing law enforcement, bringing all partners to the table. We have to sound the alarm. We have to go into our schools. We have to let women, children, young boys, girls, men, all know that this is real. Be watchful, be smart, don't fall for the, do you need this? I can buy you a brand new pair of shoes, red bottoms. Don't fall for that. I'm telling my young girls, do not fall for that. Just go without it. Be safe, because once you get into it, and you will hear from Ms. Alice next, it is very difficult to get out of. So I thank you for the opportunity to share, and you'll learn more from Alice Cole.
Thank you, Dana. I just want to thank y'all. You showed up, and I just want to honor you. You could be anywhere and you're here. And I think of the young people, and just like what you talked about, is that if we as adults show up, then they're going to see us. And I think about, as she's talked about the problem, the issues with birth daddy, birth mama, and all of that. And I just think about, you may be sitting here, well, I don't have children, or my children are grown, or whatever. But I'm just telling you, if you don't have children and you think you're not a mama, you can be a mama. There is a need for people, male and female, to have a mama. And I have worked with so many children for untold amount of years, just like it's like there wasn't even a name for human trafficking back then. When I worked with child protection, when I've gone into the streets, when I've gone into the strip clubs, when I've gone to the block, where the pimps owned the block, when I've gone overseas, and it's the same everywhere. When I've gone into clubs in other countries and have translators, they ask me, why do you even want to come in? Like, why? And this is my response. I want them to know you are not forgotten. Okay? And we are in a place in our nation, you know, all the way down to our state, in our city. You know, this is Women's Health Day. And I was sitting there listening to each thing that was said, and I thought, you know, health, if you think about it, we need to be physically healthy, we need to be emotionally healthy, and we need to be spiritually healthy. So we can leave a legacy behind us. You know, if you say you're a leader, you turn around, there's nobody behind you, you just taking a stroll, okay? We need to be the example, okay? So now I'm going to try to talk to y'all about trafficking. Bring it down. Okay, so I'm going to give you some definitions, okay? And this is according to the federal law. Sex trafficking is the recruitment, harboring, transportation, providing, or obtaining of a person for a commercial sex act. And this is induced by force, fraud, or coercion. And that is the same under the labor trade. And I just want to say, in layman's terms, that means anyone of any age who is forced to engage in activities, sexual or vocational, against their will for someone else's profit. But if you are under the age of 18, it becomes human trafficking in exchange for anything of value. I've met with kids where they were hungry and they got a Happy Meal in exchange for sex. Okay? I've met with kids, they wanted the nails, they wanted, you know, the hair done, they wanted the shoes, the tennis shoes, all of that, anything in exchange for value. Okay? That becomes human trafficking. That is not prostitution. So many people I've met, and they're like, I'm in this because I want to be. And here's the deal, is prostitution, that definition, you have to be an adult. Okay, and what happens is, like if you want to buy me, I give you a price. You give me the money and I keep it all. There is no kickback behind me. Okay? And in human trafficking, some people believe, oh, okay, wait, I'm a prostitute, and I'll meet them and they're 12 years old. And I'm like, no, there was an exchange of something. You didn't get to keep a thing. I'll have girls in designer clothes that have been arrested for theft. And when I begin to meet them, it's like I have to point out to them, everything that you have on, you do not own. If you tried to get out, they're going to keep it all. I had one girl, she was marked. She was branded with a tattoo on her leg with his name. She said, he asked, where are you going? She said, I'm leaving. He goes, no, I own you. That's on your leg. I'll cut that off before you leave. And these are true stories, and they're local, right here. Okay? Average age of entrance into human trafficking, for girls, it's age 12 to 14. For boys, it's 11 to 13. Now, that's the national statistics. For years, I said the youngest girl I ever worked with, she was 6 years old. But 2 years ago, I met a girl at Target on Segan, because we provide services and she needed clothing. She had gotten out of the life, so she needed clothing. And we walked in there and it was August, and she said, I need anything long sleeve. And I'm like, long sleeve? And she begins to show me. She said, see, my mama sold me to pay for her drug habit when I was an infant. And they burned me with cigarettes to make me lie still. And she said, so I just want clothes with long sleeves to hide my burns. Now let me go back to the 6-year-old. When I met her, this was her story. She said, if you look at my report card, I did not fail because of my grades. I failed because I was absent. And she said, but no one ever asked me at school, why are you absent? They just assumed I was lazy and my family did not care about education. She said, so in first grade, I'm going to class, I'm going to school, and there came a day, my mom says, today you stay home. And the men lined up down the hallway in my home. And I had to have sex with them until my mama got her drug money. And do you know what? She made it through the whole school system. I went back to my office. I had 2 survivors, and I asked them, how did we miss you? You are degreed. Like, you are educated. And I know you were in my classroom somewhere. How did we miss you? And one girl said, oh, I was so relieved to get to school, I just sat on the edge and didn't talk with anybody. They named me daydreamer, made fun of me. And the other girl said, oh, not me. When I got to school, I beat up everybody. I started a fight in the classroom. I started it out in the hallway and outside. And they named me Rebellion. But you know, both of them told me, no one ever asked us, why are you this withdrawn? Why are you beating up everybody? And they made it all the way through. They co-train with me today. Because I'm like, they're all around us. If we just begin to look, if we begin exactly what she said earlier, go from an I to a we. Let's take responsibility instead of pointing fingers at everyone and just say, wait a minute, what can I do? How can I see? How can we begin to validate young people? I met with a girl a couple weeks ago. And she texts me, and she's crying, and she said, I've never had anybody see me. Come on. And I mean, that riveted through me. I was like, we have got to take the time to validate our young people. Because if we don't, there are people out there waiting for it. They are waiting. 10 to 15 is the average number of sex acts per child per day. I had a girl, I'm going to tell you, like a lot of people think, oh, it's poverty or they're hungry. This is the way I describe it. I've worked from the ditch to the country club, okay? Outside this window, there's the river. I've been on outreach downtown on the other side of the levee, met a 21-year-old mom, and this is what she told me. This is all I know how to do is have sex. She said, this is all I know. All my life, this is what's been done to me. She goes, but look at my 2-year-old. They now want to buy her. Can you help me out? Baton Rouge Country Club. I met a girl. She was 18 years old. Her parents were involved in the interview. She was going to be a model. You know, social media world. She's going to be a model. They interview her. She really does runways all over the U.S. for 6 months. Then it changes. And she was turned out. She ended up in the porn industry out in L.A. She had to be with the men. She told me, Miss Elise, this 10 to 15 a day, she said, I had to service between 20 and 30 men a day and be videoed. That is the porn industry. But she thought she was going to be a model. You know, that's why we got to be mamas. Okay? And we've got to become women that are like, wait a minute, I want to make an investment in the people behind me. Okay? So, red flags in relationship with older men are unwilling to discuss relationship. I usually ask, do they have a boyfriend or girlfriend? And, you know, they'll smile, yeah. And then I'll go, well, how old are they? And there's some, well, you know, they're 17. I know I'm 12. And then there's some, I've had a girl look at me and she said, none of your business. Well, her boyfriend was 42. And she was the one locked up in jail for theft. What did she steal? Lingerie from a Walmart. I am talking to people, what 13-year-old, if she got anything to steal, is going to steal lingerie? Okay? And so we got her out. She was doing time for that, for her pimp. Who is targeted? All social classes, all races, all ethnicities. Gosh, I can tell you. All socioeconomic groups. Anyone who has an unfulfilled need for love or attention. Okay, history of loss. Death of a parent, divorce, recent breakup, suicide of a friend, family relocation. Children who do not have strong male role models in their lives. Children in foster care, LGBTQ, runaways, anyone who lacks resources, okay? Poverty, history of abuse, addictions. I mean, we've heard, you know, we're 50, number 50, our statistics, and it's right there. Entry points, recruiters, wherever children or teens are found. Friend of a friend, replacement recruiting. One of my girls, all of her life, she said, I was basically just, the way my life was, I believe that all men have sex with children. She said, so, I just wanted to help somebody somewhere. I had no purpose, no life. Nobody saw me. And a friend of mine said, would you help me go get my belongings from this man? And she was like, oh, yeah. And she got there, and he liked her, so he started dating her. He was a Romeo pimp, and that's what they do. They date them. And she fell in love with him, and 6 months later, what happened? She was turned out. Okay? And so grooming begins with attention and compliments, leads to dating, isolation from family and friends, and then they go into the life. Social media connections. Okay? In social media connection, I met with a mom and her daughter. Her daughter was 13, and right here on Instagram, a guy began following her and began to tell her how beautiful she was. Then they began private messaging, no texting, just all in social media. Then they got on WhatsApp, and then they just fell in love. Okay? And so then he says, well, why don't you take off your top? So ultimately, well, you love me. So she does. And she's sending it back and forth, back and forth. And then he says, well, why don't you take off your bottoms? And she said, no. And he says, you don't do that? I'm going to send this to your parents. You don't do that? I know your friends. Like, we're all in group chats together. All that. I will send this to everyone. And that mama has brought her daughter in of like, what do we do next? And she did not want him to get in trouble. And then I looked her in the eye. I said, I want you to know you're not the only girl. He is doing this all over this city, this area, I assure you. And it came back. There were other girls that they started talking. They started saying stuff. Police got involved. He has young girls all over 4 parishes in this area. He is an adult, and it's all through this. Okay? So, what can concerned parents do? I'm just going to tell you, and even us as a people. Love your children, love these children, or someone else will. Okay? They're coming for our next generations. And it's time that for us that we stand up. Educate yourself on technology. If you have children, be involved as a parent, not a friend, a parent. My 8-year-old great niece last night came over with a Kindle, and I'm like, what's that? And she's like, my mama got that from me. She goes, do you know there's kids messaging? And this is me in slow-mo. What did you just say? She goes, it's not for adults, they can't get on it. I said, there are men that will pretend they're young boys, even young girls, to get you. And she's like, no, it says no adults allowed. And I said, wait till your daddy gets over here. She begins telling her dad, he's a cop, he's SWAT, K-9. He just said the Kindle's going. I said, I'm in agreement. Big Mama has spoken, we're done. She asked me when she can date. I said, when you're 40. When can you get Pierce-Steers? When you're 40. So I just tell you, talk about human trafficking to your kids, into the community. And I just, it's like leaving here. We need to go from the I to the we. Yes. Thank you.
I just want to thank y'all for coming here and standing up for what you stand up for. We may not always agree, but we all want great things for Louisiana, and I think it's going to take all that effort. But I know it's women's health, and I appreciate everything y'all are doing, because it's, again, we've got to keep it. We had a breast cancer group in the chamber this morning. There's constant need for making sure people are doing what they can to take care of themselves. Regina and I are out there every day in our district. She's in the city. She's the city mouse. I'm the country mouse, and we're trying to just let our people know what we can, what we can do to help. So I just want to thank y'all. And Elise and I didn't get to hear all that. She scared y'all, didn't she? I hope she scared y'all, because you guys better pay attention to what you're looking at on your phone, and parents and grandparents need to not put this in a child's hand who thinks it's an innocent place to go. It is not an innocent place to go. And I'm frightened of it every day because I've got grandchildren, and my 15-year-old granddaughter just got a phone. 15, she's never had a phone. And I'm so scared now because she's got a phone. And anyway, so just be vigilant, pay attention, and keep on keeping on. Thank y'all. Appreciate it.
But this whole notion about change really starts with you. It starts with you. It starts with me. And when you and me work together to change, to bring about change, to first change ourselves, to be our best selves, and then to change the conditions that we see around us, then we can have the change that we want to see. Things can happen that we don't believe will ever be, that can never happen. They can and they will. If we believe we can do it and we work together, we can do it. Do you believe that? Yeah. Do you believe that? I don't have time to give you examples, but I could give you many examples of how when we work together, when we choose to work together, we can amount change. We know in this state we need an increase in the minimum wage, right? Who in here doesn't want to see an increase in minimum wage? Anybody? Anybody don't want to see an increase in minimum wage? So, okay, so what are you going to do to help get an increase in minimum wage? The governor has been trying since he got elected. He has supported it. So all of us have got to come together and work together and help our policymakers understand the importance of increasing the minimum wage. We as women need to be more informed. We need to be more engaged and more active in issues that impact us as women. We need to pay attention to what's happening in our among policy in policy forums, such as what's happening here today at the Capitol. There are so many different issues that have come up. Access to health care, of course, is a huge issue. We know that if women have access to health care, preventative health care, those mammograms and pap smear screenings that can detect cancer early, that the prognosis is so much better. So access to health care is very important. We know that, as I said, family economic security is very important. The minimum wage, I don't know that that's being debated today, but I know that there are attempts to increase the minimum wage. We need to increase the minimum wage to help lift women and families out of poverty.
If people have questions like more information, what should they do?
For more information, you can contact us through our website, which is www.lahealthequity.org. And again, that's www.lahealthequity.org.